is Neily on Nutrition. I'm with Todd Whitthorne. He's an executive of the Cooper Aerobic Center in Dallas. He also oversees the supplement line Cooper Complete. And we are outside today appropriately because we are talking about the sunshine vitamin, vitamin D.
Vitamin D.
Yes.
The vitamin that's not a vitamin.
Right, exactly.
You know, most vitamins we can't manufacture.
Right.
We have to get in supplements or ideally in food, obviously. But vitamin D we can make, and we've been making it for a long time. When that sun hits our skin, beautifully, we manufacture vitamin D. We synthesize it in the kidneys and in the liver. Right. And what's interesting is that it's really not a vitamin. It's a steroid hormone. And it is so important in all aspects of overall health because about 10% of the human genome is regulated by vitamin D. So it's just a messenger hormone. It flips on the switch or turns off the switch depending on what's supposed to happen within the gene or within the cell. And if your bucket's low of vitamin D, that's a problem.
Gotcha.
And a lot of people have empty buckets.
That's where I get a lot from my clients. Well, how do I know that, if I need to supplement or not? And the answer is?
There's only one answer, and that's to get a blood test, because
Yes.
you can never ever guess what your vitamin D level is. You have to ask your doctor. Sometimes doctors will do it. Now, more and more routinely, doctors will automatically measure it, but not all doctors are created equal, so you have to ask your doctor. The test is actually called 25-hydroxy-vitamin D, but just ask your doctor for a vitamin D test. They'll know what you're talking about, and get it measured.
Okay.
The data is really fascinating. We know at the Cooper Clinic, where we see about 7,000 patients a year, that 82% of our first-time patients are lower than we would like them to be in vitamin D. The cut point, the bare bones cut point for vitamin D is 30 nanograms per milliliter, and the research indicates nationally, in Haines data that was published in the Archives of Internal Medicine, 77% of American adolescents and adults are low in vitamin D. That means they're below 30. Sometimes they're below 20 and even into single digits. So don't be surprised if you get yours tested and it's really, really low. But it's not where you want to be. You absolutely want to get your blood level of vitamin D up to at least 30. Okay. You can do it from the sun or through supplements, as you certainly know. And the great thing about vitamin D supplements is they're cheap. They're not expensive.
Right, they are. So, so bottom line is really the only way to know is by getting a blood test from your physician.
Exactly.
Okay, great. Great take-home message. Thanks, Todd.
Sure.
Thanks for watching Neily on Nutrition, and we'll see you in the next video.